In this video, we'll discuss apnea and SIDS in infants. Apnea is defined as a lack of breathing for greater than 20 seconds. To get a feel for how long 20 seconds is, pause the video here and time yourself holding your breath for 20 seconds. Did you do it? Most people find that 20 seconds is a lot longer than they think, especially when they realize that we're talking about infants, newborns, little tiny babies here. The scary thing for caregivers is that babies don't breathe the same way adults do, so they always have some pauses in their breathing. This graph shows you what periodic breathing looks like. This is completely normal in newborns, and then babies slowly grow out of it until they're about 6 to 8 months old. What you see in the graph is the air flowing through the nose, the oxygen saturation, chest wall motion, abdominal wall motion, and then end-tidal PCO2. This is the carbon dioxide leaving as the baby exhales. So what you can see is that the baby takes a group of a few breaths and then pauses, and then a group of few breaths and pauses. And again, we have these big long pauses in between where the infant stops breathing. What you can see though is that the arterial oxygen saturation stays perfectly steady. So these pauses in infant breathing are perfectly healthy. There's nothing wrong with them, no harm to the infant at all. And they can last up to 20 seconds and still be considered normal. It's important for us to warn new parents about periodic breathing so that they don't panic when they see their baby pause. Sometimes an infant really does pause for greater than 20 seconds though, and then we can have what we either call an AllT or Bruit. So the AllT is an apparent life-threatening event, and the Bruit is a brief, resolved, unexplained event. Both of these simply mean that the baby stopped breathing, there was some kind of apnea for greater than 20 seconds, and it's usually also associated with some kind of color change, either turning red or purple or blue, and then some kind of change in muscle tone, either going limp or going really rigid. Another hallmark is that the caregivers are universally terrified by this event. If an AllT or a Bruit does happen, the parents will usually either call 911 or bring the baby right to the doctor, and we do want to do a thorough assessment. Sometimes there really is something underlying, maybe a neurological disorder, maybe that was a seizure they witnessed, maybe there's an undiagnosed cardiac problem or a severe respiratory illness, but a lot of times that baby will now appear perfectly normal and we can't find anything wrong with them. In that case, we just need to focus on education for the parents. So one of our main priorities is to make sure that the parents have been trained in infant CPR so that if it happens again and lasts longer than 20 seconds, then they know exactly how to care for that infant while they wait for emergency medical personnel to arrive. We also review safe sleep practices just to make sure this wasn't a SIDS in the making. And we'll go over feeding techniques and what they're feeding and then keeping the infant upright to minimize any chances that this was actually a choking episode. Ultimately, though, the infant is usually discharged home, and we just encourage the parents to follow up closely as needed. Now, an AllT or a Bruit is witnessed, but we also know that sudden infant death syndrome can happen in infants, where for some unknown reason, the child simply stops breathing while sleeping. I know we covered this when we did our infant safety, so by all means go back and review those notes for more detail, but we'll do a brief review here. Remember that SIDS is first and foremost unexplained. Even after thorough investigation, we have no idea what the cause of death is for that child. It also always, by definition, happens in an infant less than 1 year old, but the vast majority of those cases, about 95%, are actually less than 6 months old. We also know it occurs in males more than in females. Of course, our main concern with SIDS is to prevent it. So let's review that safe sleep for babies is on their back. This graph shows that as parents increased the rate of back sleeping for infants, the rates of SIDS decreased. In addition to putting baby to sleep on the back, the other important preventative measures include a firm mattress, sleeping in the crib rather than with the parents, not smoking around the baby, and making sure baby's not overheated. Remember that pacifiers also seem to help decrease the risk of SIDS. So we do recommend that parents go ahead and let baby take the pacifier to bed as long as that's something baby enjoys. So this was a super quick little video, but just to recap, apnea means you stop breathing for greater than 20 seconds. Periodic breathing is perfectly normal for infants. And SIDS prevention is a major safety consideration for infants under 12 months old.